Trinity Health Livonia will be transitioning IV catheters from the BD Autoguard to the Supercath 5. These devices are very similar, but there are some key differences you should understand before using the new catheter. The same gauge catheters will be available for the Supercath as we saw with the BD, and they use the same color coding system. The Supercath is 1 mm longer than the BD, but that will have no impact on your practice. Looking at the devices themselves, you can see that the overall size of the BD is larger than the Supercath. The BD has flared wings to use to grip and control the catheter, where the Supercath has ridges on the side to aid in grip and control. Again, not a huge change, but it will feel different in your hand, and may cause you to need to adjust your technique slightly. They both have a button on the top to activate the needle retraction. They look slightly different, but work exactly the same. There is a difference in the retraction speed, though. As soon as you push the button on either catheter, the needle is pulled back into the handle to safely contain the needle. The BD retracts extremely quickly. The Supercath is a noticeably slower retraction. This is supposed to be less uncomfortable for the patient, and it also is supposed to minimize the risk of any blood spray caused by a quick needle retraction. The needles, though different in length, are still hollow and beveled. However, the Supercath needle is designed to be significantly sharper, to make insertion easier and less painful. You may notice not needing as much pressure to puncture the skin. The potential negative impact on this is that you may find you very easily puncture through the opposite side of the vein and go subcutaneous. Remember to decrease your angle after you see flash. If you advance too far at a steep angle, you will likely push through the opposite side of the vein. Probably the most significant change with the Supercath is in the catheter. Looking into the catheter hub, you'll notice a plastic valve device. It is visible through the hub or looking straight down into the catheter. If you look at the BD, you see it is completely opened through the entire hub. This new valve in the Supercath blocks blood flow after you remove the needle from the catheter. This is the BD, which we have been using at Trinity Livonia for a long time. After successfully accessing the vein, you remove the needle, and blood flows freely from the catheter. You have to work quickly to minimize the mess. Many of us rely on blood flow to verify that our IV is still inside the vein. The Supercath's valve stops this blood flow. After successful insertion and removal of the needle, there is no flow of blood. This allows you to take some time connecting the tubing without worrying about continued blood loss or making a mess. The drawback is that we can't rely on seeing that blood flow to verify that we are still in the vein. As soon as you connect the extension tubing, the valve will be pushed open and you will be able to freely flush or pull back to get blood return, and that will verify placement. The valve does not impact the presence of a flash when you first access the vein. You will see blood flash in the catheter and in the handle, just like you would see in the BD. If anything, the flash is more visible in the Supercath. It really fills that handle nicely. Insertion steps are the same for both catheters, so nothing really changes there. These differences are the only real changes between the two, but anytime there is a change in supplies, there is the potential for confusion and mistakes, so be sure to understand your new equipment before use.